Good evening, everyone. Thank you for joining us today. I'm going to go ahead and get started with our guest speaker today. Our keynote speaker this evening is Dr. Angela Guzman. Dr. Guzman is a graduate from FSU College of Medicine and the Bridge to Clinical Medicine program. She is also a former undergraduate STRIDE participant, mentor, teacher, and coordinator at the Orange County STRIDE program as well. Dr. Guzman is currently board certified in obstetrics and gynecology. In addition, she's an active junior fellow of the American College in Obstetrics and Gynecology and a member of the American Association of Gynecologic Laparoscopics. Dr. Guzman is committed to providing the highest quality of care for women. She practices high and low risk obstetrics and general gynecology. In addition, she performs minimally invasive gynecologic surgery for benign conditions using both laparoscopic and Da Vinci robotic approaches. Dr. Guzman received her undergraduate and graduate degrees from Florida State University. She remained at Florida State University for medical school, where she was inducted into the Alpha Omega Alpha Honor Society and the Gold Humanism Honor Society. She completed her residency in obstetrics and gynecology at Winnie Palmer Hospital for Women and Babies in Orlando, where she was selected to serve as administrative chief resident. Dr. Guzman is married and enjoys mentoring youth, volunteering in her community, writing poetry, traveling, and spending quality time with her family. Without further ado, I would like to introduce Dr. Angela Guzman.
Thank you, Amanda. Good evening, everyone. And first and foremost, thank you for coming. Thank you for your time. I know that my bio said a lot of things, but I wanted to share with you my backstory and how I arrived to the position that I am in today. And what most people don't know about me, and actually my colleagues don't even know because I don't share it much, is that I actually didn't come from a silver spoon. I actually am a descendant of teenage parents. My great grandmother had her first child at 16. My grandmother had my mom when she was 16 as well. And she actually had her first child at 15. And my mother had me at 17. And so I actually broke that chain. I'm the link that broke the chain in our family. We don't have a lot of people who went to college in our family. We have a rather large family, and there's actually been three or four people who've actually gone to college, and only two subsequently went to graduate school. And so, in addition to coming from a teenage mother, my father actually was not in my life for 8 years because he went to jail. Because when you have three kids, by the time you're 18, there's not a whole lot of ways to provide for your family. And provisions was what he wanted to do. And so he did that by selling drugs. It's something that I'm not ashamed of, and neither is he, because my father went to jail trying to provide for me. And for that, I will forever be thankful. And that was a rough 8 to 9 year stretch. But when he did come out, my parents got together and they still didn't have a whole lot of money. In fact, my friends kind of joke with me that I grew up with this queen size bed, but the truth is that was the only thing that my mother could afford. And I had it all the way until I went to college, that same bed, because that was what she could afford. She couldn't necessarily afford to keep buying furniture. So she bought me furniture that I would literally have throughout the years. And because of that background, it helped form me into the woman that I am today and made me just extremely appreciative of the position that I'm in today. But outside of just surmounting my original upcomings, I ended up going to Florida State University because I literally couldn't afford to be too far from home. And I needed to be able to help to work to continue to assist with my sisters and my other siblings. And that's how I ended up at FSU. At FSU, I had the opportunity to get in contact with a phenomenal support system, and that was through MAPS. And so, even as a freshman, I saw a flyer, and I'll never forget just seeing the Multicultural Association at that time for pre-medical students, and I gleaned at the opportunity to just go to the meetings. And from those meetings, that's actually how I got involved with Stride and how I was able to be a mentor for Stride when I was a pre-medical student. And then subsequently I went on, and because of Stride and because of MAPS, to go on to the Bridge to Clinical Science program. And so the reason why that is super important is because even from the inception of my freshman year, I didn't know where to go. I didn't have guidance. I didn't have anybody telling me what to do. When I applied for college, my mother was like, baby, you're going to have to do it yourself, because she didn't necessarily know the steps. But I knew that there was something in me pushing me to greatness, saying that, hey, you got to figure it out. And I did. And coming into MAPS and being exposed to STRIDE and being in the bridge program literally gave me the tools that I needed to build my future. And I think that that's something that a lot of people undervalue. And when you're in the thick of it, and when you're in high school or when you're in middle school, you don't always appreciate the exposure that you're getting. But having to be basically being in that environment is what helped me to be successful. I don't think that I would have been able to matriculate into medical school and to be successful if I didn't have that early support system. And so that is kind of why I was so passionate about having the opportunity to speak to you guys today, because I really wanted to share my life story, my backstory with you, and to answer any questions that you guys had for me in regards to just how I was able to surmount some of the things that I've been through, and how I was able to be successful today.
Thank you for sharing that, Dr. Guzman. If any of you students have any questions, you can put them in the chat and I'll see them out loud for Dr. Guzman to answer, or you can just put your name in, and then once I call on you, you can say your question out loud. Okay, the first question I just received is, what is your typical schedule like? What are your hours in a typical week, and is there time for family?
A schedule. That's so as an OBGYN, you kind of have to be a little bit sporadic. And I don't know if you guys ever saw the movie Up, but there's this dog in the movie Up that's like, oh, look, squirrel. You kind of have to have that mentality a little bit, because the schedule can definitely be all over the place. So even when I'm in the office, I do have a very typical 8 to 3:45, or pretty much 4 o'clock schedule, where I see patients. But then I'm on call at the hospital, and so when you're on call, you're literally sitting, you live in the hospital, and that can vary. So it's never the same. This week coming up, it can be I'm doing a 24-hour shift on Saturday. Sometimes I have 12-hour shifts during the week, and they could be day or night. So my schedule will vary, but the thing that remains the same is that I'm always in the office or either at the hospital. And in terms of family, you make time for what's important. You absolutely. I just had a baby 2 months ago, and I have a 24-hour shift, and my husband's going to bring me my baby while I'm at the hospital. Like, you just, again, you make time for family. And so, whenever you're picking a career, never pick it based off of what you think is going to be a limitation to your schedule, because you can mold your schedule into whatever you want it to be.
Thank you for answering. Sounds like you have to have a lot of balance to be able to do both, but it's manageable.
It is definitely manageable. It's not always easy, but it's manageable.
Okay, the next question that I got is, did you always want to be a doctor, and why did you choose this specialty? And is it exactly what you imagined?
Yeah. So actually, I wanted to be a veterinarian, but again, my dad, because he had, as I mentioned before, 3 kids by the time he was 18, and so when he got out of jail and he did come back, and we were growing up, he sat all of us down and he said, "Hey, what do you want to be?" And I said, "Oh, I want to be a veterinarian. I really love animals." And he said, "That doesn't pay the bills." And he says, "If I'm going to pay for you to be a doctor, you're going to be a people doctor." And here I am. I am a people doctor. Thank you, Father. So that is actually how I ended up saying, okay, well, I guess I'll be a people doctor. And then I started looking at what that entailed. And I'm absolutely elated at what I do. It is everything that I imagined and more. There are definitely ups and downs. I mean, there are happy times with anything that you do, and there's some frustrating times, but it's rewarding, and I wouldn't pick anything else.
That's good to hear. The next question that I have are, how often are you on call for 24-hour shifts?
Usually once a month. So my shifts are broken into, again, 12-hour shifts and 24-hour shifts. The 24-hour shifts are they're variable, but about once a month, and that is with my choosing, because I like my weekends, and so I could either work 2 weekends a month, or I can just work a 24-hour shift to get it done, and then have my other 3 weekends to be with my family. So that's why I choose to do 24-hour shifts.
Okay. Another question that I got is, if you could change anything about your profession, what would it be?
I would actually change the fact that there's so much litigation around women's health and women's ability to make a decision. One of the most frustrating parts of what I do is that my inability to really help women on some very fundamental levels. And I think the best example of that is when patients, let's say they don't have insurance, or some insurance plans limit access to things like birth control or medications, it limits my ability to help people. And that is extremely frustrating. Is one of the things that I honestly think is kind of one of the downfalls to how our society is structured. And so if I could change anything, I absolutely would change that, because I think everybody should have equal access to care. And I think that everybody should be able to afford medical care and attention without having to sacrifice the necessities of life.
Okay, thank you. Another question is, do you work weekends or just Monday through Friday?
I'm going to go ahead and apologize in advance. I have a very, very determined 2-year-old that's trying to break through the window, break through my office. So if he comes in, I'm so sorry, you guys.
It's okay.
So please ask that question again.
Do you work weekends or just Monday through Friday?
No, I do work weekends. And so, as I mentioned before, usually the only time I'm working weekends is when I'm on call at the hospital, and that entails delivering babies. So, for those who don't know what obstetrics and gynecologists do, we pretty much are baby doctors. I take care of women when I'm in the office. I get to deliver babies when I'm at the hospital. And if you ever get a chance to see a delivery, do not YouTube it unless you have your parents' permission. Then it is one of the most magical things that you can ever be a part of, and it never gets old.
Yeah. Okay, and then what type of surgeries do you perform and how long are these surgeries?
So they vary. I do things like C-sections, which is a surgical delivery of babies. I perform hysterectomies. C-sections are usually an hour. Hysterectomies can be about 2 hours. And then any other surgeries where sometimes you patients come in and they have a pregnancy somewhere where it shouldn't be. It's called an ectopic pregnancy. And that is always an emergency. It's actually one of the reasons why a woman can pass away from having a baby. And so, because it's emergent, you always, always, always have to treat the patient very quickly. And those surgeries can be anywhere from an hour. I mean, I've been in one for 2 hours. I mean, it can definitely vary. So, there's a lot of diversity with what I do, a lot of sporadic, a huge sporadic schedule, but always rewarding.
Okay, thank you for that again. How often are you in clinic versus in the hospital?
So, again, variable. And it's just the theme of obstetrics. Usually, I'm in the hospital at least once, sometimes twice a week. And then when I'm not in the hospital, I'm at the office. So, usually, I can anticipate being on call about once or twice a week.
Okay, and then are there OBGYNs that strictly do only surgeries or only work in clinic, or do you have to do both?
No, no, absolutely. Well, so clinic is actually how you get your surgeries. I'll go ahead and see that. But there are, so because obstetrics and gynecologists is two parts, you can choose to be a doctor that only delivers babies and only be in the hospital. And then you could be a doctor who only does gynecology, and that's literally only in the office. And so some people who are only in the office and they only do gynecology, they also do surgeries as well. And so the surgery, you can be a OBGYN who specifically only does GYN surgeries. And that type of surgeon is called a minimally invasive surgeon. So if you are really passionate about surgery, but you're not sure what kind of surgeon you want to be, obstetrics and gynecology is a really good field to think about that.
Okay, interesting. Mhm. What do you do if you do not know how to do something or how to treat a patient?
I ask for help. even at every stage of life, you always ask for help. And I still do a lot of reading and I still look things up. And so if I come across a patient that I don't know what to do, I literally will either phone a friend, I'll call some of my senior partners. I am never ever afraid to ask someone else for assistance. And that kind of just honestly at every point in your life, I know sometimes it may seem like it's a burden to reach out to other people, but if you ever find yourself in a situation where you don't know what to do, especially when someone's life is on the line, you always put your pride aside and you get somebody else very quickly.
Okay. Another question that I got are, what are the best parts of your job and what are the worst parts of your job?
Okay, so best part of my job, like literally top three. One, again, I get to hold a baby before the parents even get to hold a baby. It is the most magical thing. And to be honest with you, I am 7 years into this from my training, and the feeling never gets old. Like it just gets all warm and fuzzy, like you're eating ice cream on a hot day. It is just that, like that kind of feeling. Um, that's the first thing. The second thing is the relationship with the patients. You build relationships with patients and you build bonds with people. And sometimes you end up getting friends out of the interactions. And that is what being honestly a physician is all about. It's actually what keeps me going is being able to be with patients in the most critical moments of their life. I have one patient who I was there for her when she lost her first child, and then I was there to help her get pregnant with her second, and then she came back with a third. So those are the things that make the job, worth doing. Worst part is the exact opposite when you have walked a road with somebody and then to lose a child at any stage of pregnancy is always very difficult. Loss is never easy. I've lost, patients too, and that part is always the most difficult. And sometimes it's not being able to help people and not having the words to say, but just having a presence. And sometimes as a physician, that's all you can do is just be present with somebody in the worst times of their life.
Definitely. Thank you for answering that. Another question that I got is, how stressful was your internship?
Um, that is a great, that very, I'm not even going to sugarcoat that, people. Very. It's because the best way that I can describe it is imagine that you don't know how to swim, but somebody just pushed you into a pool. That's kind of what happens when you're an intern. Like you come out of medical school with all this knowledge and you feel so smart and you have these letters behind your name and you know zero about what you're about to actually do. And that is when it becomes like it's challenging because you want to be able to do so much, but you have to learn. So you literally become like a baby learning to crawl and learning to walk and then learning to run. And then if you get good enough, you get a jet and you learn to soar. And it's the best feeling ever. It's like when you can just soar on your own. But that's what training is about. And it's a necessary process, but that's the best way I can describe that.
Okay, thank you so much. What are some of the obstacles that you have faced?
I think the hardest obstacles that I had to face from the inception, which actually I want to kind of go back to my backstory, something I meant to say, was when my mom had me, they actually told her that I wouldn't be anything. So I had family members on both sides who told my mother that once she had me, her life was done. My life was over. We were just gonna keep being the same, chain. We would never get out of where we were at. And so one of the hardest things that I've had to do was to ignore those voices because everybody's not always rooting for you. When you come from an area where people aren't successful and they don't know what success looks like, and then you achieve a level of success, when you come back, you're thinking they're going to root for you and welcome you with open arms, but instead they welcome you with harsh words of you think you're better and things like that. And so I had to learn how to shut down those voices and to root for myself when other people aren't rooting for me. That I think is just like an overall life lesson. And that honestly starts right now. Like just because you may be in middle school or high school, like you have to learn how to drown out voices of people who don't mean you well, because from now until you reach a level of success, you will have that. And so that's pretty much one of the hardest things that I had to do, was learn how to have confidence in myself and that I could do it, even though I had never seen it be done before.
Thank you for sharing. Another question that I received is, have you ever had to deliver a baby outside of a hospital, or like maybe not in like a traditional setting, maybe?
Parking lot, that was about it. So we do have people who come in labor and they don't always make it in time. So I think the two most memorable was a lady in the parking lot, and the best scene ever was one of my supervising physicians. It was kind of like from a movie where we ran outside as a team, and then we just watched one of my supervising doctors take off his shirt and wrap it around the baby, even though we had blankets. And so I'm not really sure why he felt the need to do that, but that was pretty awesome. And then the other time too was there was a lady who they came to the back of the hospital. They didn't necessarily know where they were going, and she had on spandex pants, and you literally saw the baby coming through her spandex pants, like her pants started to stretch as the child was coming out. And so we had to stop where we were and deliver where we were and then move her to the emergency room. So that was fun.
Wow, those are some interesting stories.
It's fun. It gets crazy.
Okay, the next question I have are, what are the most important qualities of being a good doctor?
I would say to listen. So a good doctor should listen first and then ask questions. They should be compassionate and empathetic, even though I may not be able to understand completely what someone's going through. I should always be able to empathize with what they're going through. And that I think that that's to me the most important. And the other thing is they should be knowledgeable, because at the end of the day, you want someone, when someone brings me their problems and they're spending money to spend time with me, they're paying me for my knowledge and I need to have that knowledge. And so it starts with making an investment in myself and making sure that I know my practice and I have my craft down.
Okay, thank you. The next question I have is, are there things that you wish you knew before pursuing this profession?
Yes, I wish I knew how expensive it was. These loans don't pay themselves. So that is the only thing that I would say too. And oh my gosh, you guys, I also do not take out so many loans in undergrad. So fun fact, like finances was talked about in my household, but it was not necessarily something that was drilled. And you have to pay back those loans. And so, I could have took one or two less cruises because I'm paying interest on those. Great memories from them, though. So when you find that when you get the opportunity to go to college and they give you all this money, just calculate how much you need and not more than that, because Uncle Sam wants his check every month. Yes.
That is some very good advice. The next question I have is, how big of an issue is malpractice in the field of obstetrics and gynecology?
In Florida, it's a big issue. And so I can't even sugarcoat that one. A lot of times litigation can change how you practice. I am fortunate and I am faith-based. I believe in God. And I will tell you that I feel like I have been very fortunate in that I have not had any incidents, but I have, fellow residents who already have cases that they end up having to go to. And so because the state of Florida is a highly litigious, which means, you can easily get sued state, it's a big deal. But honestly, if you go to California or New York, they don't have these issues. They just practice. And so just will heavily depend on where you live. But it's a pretty big part of what we do here in Florida.
Okay. The next question I have is, do you have any more good advice?
Yes, I would say first and foremost, it does not matter if you don't necessarily know what you want to be. You don't have to have life figured out right now. And that's something that I think I didn't realize until now. You also don't have to know it all. You just have to have a passion for something, and your passion will get you to where you want to be. That's the first thing that I cannot stress enough too. And the second is it's okay to not be okay. It's okay to not feel like you're the smartest. It's okay to not necessarily always do well on every single thing, as long as in the end you're doing your best on everything. Those are things that I wish I would have known when I was back in high school, because I was so hard on myself, just needing to prove a point to people who now don't even matter. And that is the biggest thing. And so if you have a roof over your head, food, and parents or family that support you, you are doing astronomically better than a lot of people in this world. So count your blessings. Like, I really just have to start from there. And then once you get further along in life, like when you get to college, have fun, but be responsible. Be responsible. I really gotta stress that. Be responsible financially and academically, because no one is going to be holding your hand. Like, you're not going to have somebody telling you what to do. That is when the true, that's when the true you will come out, and only you can make you successful. And I can't stress that enough. Like, it's going to really come down to you and to small choices, because it's like little choices that end up giving you a big end result. And then the other thing too is, don't let other people define you. Like, I love social media, love TikTok. Yeah, it's real fun. But do not think that that stuff that you're seeing is real life people. It is not. I put on makeup for the gram too. It looks like it's a wonderful world. And then you come home and my 2-year-old is tearing up my house. Like, you just have to know that even social media and all of that stuff, it has its place. And so it's okay if you don't look the way that everybody else looks on social media, if your life doesn't seem like it's going the way that you want it to, because everybody is putting up the best fake versions of themselves. And these are things that I wish I would have known then, because I am all of, I don't know how old I am. I'm not going to disclose that. I'm older, and I'm just now learning to be okay with all of who I am. That's mentally, physically, spiritually. So those are some things that honestly I wish I would have known.
Thank you so much for sharing that. What tips do you have on interacting with patients?
Be yourself. Honestly, some will love you, some won't, and it's okay. Everybody doesn't have to. When you're with patients, just be genuine and be yourself, and the rest will come out. And honestly, you'll be just fine.
All right, the next question is, what tips do you have studying for the MCAT and staying productive after graduating from college?
So, studying for the MCAT, have a schedule and stick to it, and know your strengths. So, know what type of learner you are. I cannot stress that enough. Know what type of learner you are, because if you learn better by listening, then get material where you're listening. Go into a class. That those are the people who benefit from going to classes and being one-on-one with people. But if you're not big at listening, you're more tactile, you're a person who can do better with writing. Like, find out what kind of learner you are right now, because that's going to basically make you successful later on. 100%. And then also, don't focus so much on the initial score, but on milestones of getting there, because you might not do very well at first, but if you focus on where you start, you'll never be able to climb to the next level of where you can be. And know that you can be your own worst enemy. So always believe in you. Continue to tell yourself that you can do it, even when you don't feel it, even when you're not seeing those numbers, because your confidence is going to get you where you need to be. It does, it makes a huge difference.
Okay, thank you so much. The next question I have is, what's the worst patient experience you've had? And then how would you deal with situations like that?
The worst patient experience that I've had probably was a lady who didn't want to see me because I was black. But I was actually okay with that, if you want the truth. It was less work I had to do. So, I mean, she was very honest with me, and she asked, was there anyone else who could see her? And I said, no. However, I will find someone who can basically treat you, because at the end of the day, it's about you. It's a patient. She's sick. She's not feeling well. So I didn't take it personally. I just said, okay. And then I found a colleague who wanted to see her. So I think that for me was like just it was definitely like in my face of no, I'm woman, I don't like you because of how you look and find me somebody else. That was probably the worst. But honestly, I always remember that it's not about you. So whenever you have those kind of situations where someone discriminates against you, just remember it's not about you. It's about them and something that they're going through. And you have to give people the room and the opportunity to work through that and not to try to impose your personal beliefs on them.
Thank you for sharing that. The next question I have is how often are you seeing patients outside of your specialty, if any?
Oh, thankfully, zero. So I chose obstetrics and gynecology because I love women's health. I love what I do. Even when I volunteer at events, I volunteer at women's health events. And so I do, I mainly see women. I don't, and I see children as young as 14. And so outside of that, I don't really see another patient population.
Okay, that's interesting. The next question I have is, could you tell me about your best day on the job?
Absolutely. So my best day on the job was when I was actually an intern, well, when I was a resident, and we had 11 people in labor at one time. And it was crazy. I mean, literally, you would like deliver one, run to another room. You didn't even have time to clean up. Like there was one time where I don't know if so when a baby is born, you have the baby, and then there's something that nourishes the baby called a placenta. Please forgive me if I'm offending anyone. I don't mean to. I'm not sure where everybody's level of understanding is, but so what happened was I delivered a baby. I did not have time to deliver the placenta, so I told the patient, "I'm sorry, I'll be back." And I ran to another room, delivered that baby, went back to deliver the placenta for the other one, and then went back to the other room. Like it was that kind of day. And I mean, for my program, there was 4 people. We had like 4 residents. You have a first, second, third, and fourth year, and everybody, it was like all hands on deck that day. Afterward, it was crazy, but it was so much fun because you just realize that you can do so much. And it was a moment of growth for me where I was like, wow, I definitely have come such a long way. And to be able to handle all of that and go home with a smile was awesome.
Wow, that sounds like it was pretty intense, but
Yeah, it
cool to
was in the moment. It did not feel there was no laughing then, but now, but like at the end of the day, it was awesome. I was like, oh wow, that was pretty cool.
wow. Okay, the next question I have is how often do patients surprise you, or how frequently do you come across something that you're unfamiliar with?
Um, I come across something that I'm unfamiliar with every now and then. Patients surprise me all the time, like literally all the time. I think I have my call group is out of 13 people, and I'll never forget, I got one call where the sister-in-law of the patient called asking me to deliver the patient because the lady was out trying to get drugs. And she literally asked if we could deliver the baby early because this woman would not stop using drugs. And that was like a 3 a.m. phone call. And so I will say that this field does afford me the opportunity to have several fun interactions and lots of stories for days. For days.
Wow. Okay, so that's actually the last question that we received. If there's any like final comments that you'd like to leave us with, or anything else advice-wise that you'd like to give us, that would
Okay.
be it.
I would definitely say 3 things. One thing is that it doesn't matter where you start because it doesn't determine where you end up. And I cannot stress that enough. I think when I reflect upon my life and I reflect on where we used to live and where I used to be, and I have conversations with my mother now, we always had one thing that we would do, and we always would be positive and we would believe. And I know it sounds so superficial and it sounds pretty corny, but your success starts in your mind first. And so you have to believe that you can achieve it to do it. You have to believe that you were already given what you need to do it. And so when I was going through college, and I remember just being in study groups where people seemed so smart, And it seemed like everybody sometimes was smarter than me, or people just got it easier than me. I have one friend, she's freakishly smart. And in those moments, I had to remember that what I don't have naturally, I can still get with hard work too. And hard work will get you there. It may not always feel like it in the moment. It may seem unfair in the moment when you're studying or when you're working hard or when you're doing homework and you're doing things and other people aren't. When you're putting in time and other people aren't. My friend would go home and watch Real Housewives every night, and I'll still be studying. I was very salty. But guess what? Our grades ended up being the same. And at the end of med school, I ended up making it into the Honor Society. And so you have to remember in those moments not to compare yourself. You have to be like a horse with blinders on and just focus on you. And so it doesn't matter if, like for me, when I did bridge, I was very proud to be in the bridge program. I did not care that I had to do an extra year. I was elated to have an opportunity. So make positive experiences out of things that may seem like a rainy day for other people. And know that ultimately, as long as you just keep going, you'll get there. I don't think I can ever stress that enough. And the biggest thing too is use every resource that you have, like Stride and Maps and the Bridge program. Those are resources that are invaluable. I came across so many other medical students, especially as a resident. You get to see it from the other side, and I got to interact with other students that did not have the same support that FSU had. And I can assure you, even down to the level of attendings that we were presented with, it was so different. So just be grateful for where you are and know that you're going to be successful. It's just a matter of swimming and getting from one, just keep swimming, just keep swimming, no matter what level that you're at. So I think overall, those are the things that, like looking back now, I hold dear, and things that I wouldn't change for the world. And so also too, it doesn't matter what you become as long as you are happy when you become it. And so you're going to have people telling you what specialty to go into and not to go into. But I can tell you, I've met unhappy dermatologists. I've met unhappy surgeons. I've met unhappy people. And don't let a salary number veer you in a direction, because I meet a lot of unhappy people making money. And honestly, you cannot buy happiness. I promise you, you can buy things, but they will not make you genuinely happy. And so when you're looking at what you want to do with your life, make sure it's something that you're going to genuinely enjoy, for because when it gets ugly, that's all that you're going to have to hold on to, because money won't do it. So that's it.
Thank you so much for all the questions that you answered for us today and all the advice that you've given us so far. I'm sure all of us and the students enjoyed hearing you speak today. If anybody else has any questions, you can put them in the chat or say them out loud. But I think this concludes the end of this session that we had today. Thank you so much for doing this for us, Dr. Guzman. We
No
appreciate it.
problem. Thank you so much. I hope you guys have a good one.
You too.
Bye,
Bye
Abby.
bye.